Dr. Eric Marsh, orthopedic surgeon with the Vermont Orthopedic Clinic and Rutland Regional Medical Center, joins us today to talk about less invasive surgery when it comes to hip and knee replacements.
Hi, I'm Eric Marsh. I'm an orthopedic surgeon here in Rutland. I work at the Vermont Orthopedic Clinic and do surgery at the hospital at the Rutland Regional Medical Center. And I'll be talking today about hip replacement and why people get hip replacement and what we have to offer here at Rutland Regional Medical Center regarding total hip replacement surgery. First of all, people who get hip replacement surgery we do it for many reasons. The most common reason is just for standard arthritis, what we call osteoarthritis or wear and tear, where the cartilage on that joint surface has worn out, and we try non-operative measures to treat this first. Initially, we'll try medications like Advil or Aleve or Tylenol. We will try physical therapy or injections and things like that, but oftentimes these don't bring enough relief to people who have severe arthritis, and then those folks become candidates for hip replacement surgery. What the hip replacement surgery does is you have your hip joint here. So your normal hip joint is a ball and socket joint, and the hip moves within that socket, and then when the cartilage on the ball and the socket get worn out, that is what arthritis is. So that's a normal hip with the thigh bone here and the hip socket on this side, and when people get arthritis, this cartilage wears out. And so the treatment for it, the surgical treatment, is a couple steps. The first thing that we do is we hollow out the socket, and we have tools that smooth that out. And then there's this piece which has metal on the back with a roughened coating that will grow into the surface of the bone, and a plastic liner, and that will snap into the socket. And then on the side with the thigh bone, we'll trim off the bone right here and then actually hollow out the thigh bone, and there's a piece that goes down into the center of the thigh bone with a ball on the top. And then this becomes the new joint, where there is a metal or a ceramic ball that rubs against that plastic liner in there. And the reason we do that is to help get rid of the pain of the arthritis. What I think is kind of new and exciting about this, and I've been doing a different approach to this procedure for about 2 years now, in what's called the anterior approach. And there are a couple advantages in my mind to that approach. The big advantage is that it goes in between the muscles of the thigh and the hip. So rather than having to detach or cut through any muscles on my way into that hip socket, I'm able to go in between those muscles and push them apart to open up enough room to put these pieces and parts in. And so that does seem to help people have a bit of a quicker recovery, a bit of an easier recovery time. And so that's a big advantage. The other advantage is the position that the patient's in allows me to use an x-ray machine during the surgery. So those x-rays are able to tell me that I'm putting these pieces and parts in exactly the way that they're supposed to be to match the patient's anatomy that they had before the surgery. So we're really excited about being able to offer that for folks here in this area at Rutland Hospital.
Dr. Marsh will discuss joint replacements and the advancements that have been made in surgery the 29th of April from 6 until 8 o'clock at the CVPS Leahy Conference Center at the Rutland Regional Medical Center.